Okay, you've heard us talk a lot about doctor productivity, and this is a really kind of nuts and bolts thing where we had the idea that we would just, how do I set the table for my day? And we've talked a little bit about morning huddle. I think the morning huddle has to start here. It has to be something that you're ready to come in for, and I used to do a more extensive one, and I've gone through all that. So here's where it goes with me. I like to come in, and I'm the one who's going to coordinate my day. And it's very important to understand when you coordinate your day, if you don't plan this out, you're probably going to be much more haphazard where it goes. So here's where it starts. Coming in the morning, and this probably takes me a total of about 10 minutes. So it's not a long one. And understand that there's a lot more than what I'm doing here that sets the table for a perfect day. Keep in mind, behind the scenes, the team is preparing. They're preparing any information that's needed in each patient. They've already done the financial preparation. They've walked through to see if there's any alerts I need to really be keyed into as far as medical alerts. All of these things are already done by the team. My huddle is really in my head, how am I going to walk through and coordinate the day with the team? Because if I'm not on point doing that, it's just not going to happen. Interestingly enough, what I would kind of say to this actual process I go through is probably the number one thing that maximizes my day. To me, maximizing my day is not about looking at a full schedule. For me, maximizing my day is looking at any schedule, deciding how I'm going to walk through, where I need to pull and what I need to do. And at the end, I'll summarize what I did. So let's start here. So coming in, it's important for me to understand when I do this, the layout of my screen here is important. I want to see the entire hygiene schedule across, and then I'm at the end. This is my day. So keep in mind, in a productive dental office, you have to have really coordinated synchronization between the hygiene schedule and between the doctor schedule. So we need to do this. Now, obviously, in a multi-doctor office like we have, I mean, it's important to be able to designate who are the people who are going to treat these. Now, if you're in an office where you're checking all the hygiene, that becomes more straightforward because you're checking every patient. So you know, check every patient every time. A tenet of what we're talking in the growth platform. We have to make those constant, continual touches with patients. Not just when you get paid for the exam. When you're actually, every time a patient's in, you want to go back in, you want to make that connection, you want to have a look, they'll know that you care about them. Even better to take advantage of the fact that we don't charge for this, because if it's in the patient's mind, come out verbally and have somebody in your team tell them, Dr. Bob's going to be coming in to check you today. And in this, even though this is only an in-between maintenance check, you're not going to pay for this. So important for the patient to know that, because if you don't, the patient will be thinking, well, I only have one check a year and I've got 3 cleanings. Am I going to pay for this? Don't make the patient ask you that. It's very uncomfortable when it comes to money. Understand that. So what we're doing is, I understand we need to check every patient every time that comes in. So as I start my day, obviously I need to look, and I start with my day. So I walk through my day. Now I can't walk through my day unless I include where I'm going to be in the hygiene and where I'm going to be in my day. So first thing I'll do, I'll go through my entire day. And when I'm doing that, and in this schedule it's my yellow column here, but I will go through and I will see what benchmarks were booked. As a matter of fact, I've already looked preliminarily yesterday at this day. I already know what was happening the day before. So if there's any unusual anomalies, I've taken care of it the day before. So I'm really talking about the schedule is set, everybody's done their job, I'm coming in, I'm looking at my day. I'm sitting down, starting this day at 8 o'clock, going straight through on my schedule to 8 o'clock. 12-hour shift, guys. Great, guys and gals. So what I'm doing in this day is I come in and I need to see what I'm going to do. So obviously I want to make sure again that I want to reaffirm that what I have booked meets my benchmark. So I'm walking through an entire visit in my mind. So I go through and I walk through the visits first. And I'm looking on my schedule where I have my existing openings. I make sure that my benchmarks are booked properly. I will adjust that immediately. If I think, here's what I'll do, I'll adjust it. If I'm underbooked or I'm overbooked, I'll adjust it, but I'll also let the team member know that was in charge of this, my front desk coordinator, that she actually needs to be very aware of that, but I always scan it. I assume most often it's done, and we've also looked at it the day before. So I'm looking at my day, and I'm going through in my mind, does this patient need anesthetic? Where am I going to be going? Can I start out of the gate doing my work? Or is there time for anesthetic? And then if that's happening, where do I go to check my hygiene? So I already know in this particular day here, right away, I start at 8, hygiene starting at 7:30. I know there's 2 docs going here, so I only have to check 1 patient out of the gate here. So while I'm in here and I do have to give this patient anesthetic, I'm giving anesthetic, I'm bumping back here, and I'm in according to what my schedule is. I don't let a hygienist come and drop me a card saying, you're due for a check in op number 1. Doesn't work. Now, if they do that at the end of the day, I'm well aware that I'm going to wait till this patient's done because I've already factored it into my day. So here's the key. Just looking at my day, seeing a full slot of yellow is not what I do. That's not what we're looking at. We're looking at what I'm going to do within this hour, and then what am I going to do in this 10 minutes? Am I scheduled properly? So what comes out of that in this particular time here, I've got lots of time in here. So I already know I've got an opening in here, so I'm looking for a couple things. I'm walking through my day. Where are my openings, first of all? That's great. Where are my pinch points? When I look through, in the morning in most schedules, when you do this booking, we call assisted hygiene, we call turbo hygiene, you're going to book hygiene patients at a time that works for them. Before and after work and school, we're going to say this a lot to you, you want to make sure they come in that works for them. Not you, for them. Because when you book them at times before and after work or school, Saturdays and Sundays again, they're much less likely to cancel. They're much less likely last minute to have something else to do. So typically in our day, as I walk up through this, you'll see on our screen here, we've got much more booked at night, much more across. So we already know when we come in, usually in a case like this, we've got more freedom in the middle of the day coming up to about 3 or 4 o'clock. So as I walk back down in this, starting with my day, it's kind of cool. Mentally what I'm doing, I'm walking through, I'm seeing where I'm going to get those patients in. We usually will have some, emergencies that come in right out of the gate. We're looking where we put people in. So very often, if I have an opening, I'm looking, can I pull somebody out of hygiene? Have I accommodated my emergencies? Where do those openings go? That's very clear. Now that we want to go in and we want to look, assuming as I walk down, I need to know where I'm going to put people. I also need to know where I have pinch points coming down. So pinch points to me mean, if I'm walking through each appointment, do I have any extra time over and above what's required to put somebody in, those walk-ins, those emergencies? And also, can I pull somebody from hygiene to put in here? But I have to constantly walk through my day to see where I'm going to be. Very important. So what happens at the end of the day is once I get down, and you'll say, well, that's easy to do when you have minimal hygiene scheduled, which is going to happen. You're going to have times in the middle of the day that you're not going to be heavily booked. That's where you're trying to key people in to do that restorative treatment, to do that great treatment with a sense of urgency that you need more time to sit down to do that more critical dentistry. That's a little different than the day that happens. Hopefully you've done that in the earlier in the day. Now when we come down, pinch points become very critical when we've got times going across where I may have to be within an hour here. 1, 2, 3, 4, 5, 6, 7. I've got 7 hygiene patients to check between 4 and 5. And as I walk across here, I'm looking, okay, I've got this patient here and this patient here. If I've done my job, I've already built some extra time into my normal benchmarks in that slot. That's already predestined. That's already in our normal benchmark. So I'm looking here, I'm okay. I won't go to the treatment, I won't talk about names, but I'm doing pretty well. I got 7. That's going to be a pinch point. Well, what I do know is that I can do it with what's booked here because they've been smart enough, not smart enough, they understand what they need to do. So when we've gone through and done this, I've already pretty good in here. So here's what I'll do. Sometimes I'll say, oh boy, I've got 7 in there, even though I booked, because keep in mind, when they book my times in here, what I'll do for me is if I'm in a busy time, and they know when that is, usually from 4 to 8, I'll have them build 20 minutes into my normal benchmarks for each hour I have. So if they've done their job here, they've already given me 20 minutes. And fortunately, sometimes it works out to say, okay, I got 7 in here. You know what I'm going to do? I'm going to take this patient, I'm going to scoot her down. So I don't want anybody putting anybody in there. I've already accommodated an extra 10 minutes to queue that, and I'm thinking I can do that. But what I also know is this. Here comes the pen. Here comes low-tech people. Here's where my rubber hits the road. Once I go through, I'm going to go through and write between 4 and 5, and I literally will do this. 4 and 5. I've got 7 hygiene checks that I'm going to be going between 4 and 5. Well, what that tells me is in the middle of my busy day, when somebody comes to me and they say they got a walk-in or they got somebody, I'm not putting anybody in between 4 and 5. I'm continuing down to my day. And another thing I do on this thing, I've got my pinch points on one side, but I've also on the other side, where can I put somebody in? I've got actual physical openings. Obviously, if I think I need to do dentistry, I've got an hour opening in the middle of the day, I'm going to put somebody in there. Maybe somebody's waiting for a crown. The team is already pre-set up to do this. Keep in mind, I'm showing you something here which would be less typical for me when I'm showing in our visit here. This actual day is actually next week. So this is a real live, we're sitting here right now. This is Monday, December 14th. We're sitting here on the Wednesday before. So we're just showing as an example, this is a real live thing. So this will probably be filled with normal benchmarks, but in cases of people canceling, people not showing, whatever, we still want to accommodate on the fly. So what we're able to do here is as we walk down the night, I'm looking for other pinch points. And so we already talked about between 4 and 5. I had 7 visits, 7 hygiene checks. I'm going to check every patient every time. We have to be coordinated, and I want you to get into my mind. You can see what I'm doing in this dance. I even talk fast when I'm doing this. So in my mind, I'm saying, oh boy, when it comes down to that, I'm ready. Maybe I've got a little more coffee. I already know my day. I'm going to be on stage performing very, very tight in that period of time. When I say tight, though, I'm giving every patient what they deserve. So if I go into my hygiene check, which you've all seen that, hopefully at this point you've seen the hygiene, walk through the hygiene check, I go and I've got my treatment coordinator, the treatment's on the screen. I can get in and out of there in 3 minutes, 5 minutes, getting my checks, getting my time in, knowing what I'm doing, and it's my schedule that will dictate when I go to these places. Now, at the end of the day, I'm not going to wait to the end of that hygiene visit. If I've got 7 checks between 4 and 5 and I'm coordinating with my schedule, people, what I'm going to do is I know exactly in this period of time when I put the anesthetic in, I may bump out into a couple checks. Great, but here's what I'll tell the patient. Angela, I'm going to put this anesthetic in. We need some time for this to work. So she sits up and my wonderful face-to-face assistants spend time talking to Angela. So when I'm gone, Angela has no idea what I'm doing behind the scenes. She's used to a very busy, productive office, great radar, great culture, laughter. She doesn't know I'm running out to do 2 checks. She also doesn't know that once I do her work, I might sit down and while I've gone through and do her bridge prep, this is actual real, I won't tell you her last name, I already know that probably down there in about 30, 40 minutes, I've sat down, I've cleared 2 checks. Her freezing is in, she's ready to go. I come in, everything's ready to go. When I sit down, I'm not getting up. The only way I know I'm not getting up is because I already know I don't have another check. Now here's where sometimes some of the constrictions occur. An assistant or a hygiene assistant will come and she'll drop me a card, which means in our situation, when the hygienist is finished with the patient and the dentist has not come in from a check, that card, our famous hygiene card, will come in and it'll drop behind us. That will key me into that patient's waiting right now. If that comes in earlier than I anticipated, I'm not going to be happy because what I've got is here, I'm in the middle of this preparation. I've dictated 20 minutes, 30 minutes, docs, whatever time you need. I know once that's done, the impression's in, I've got 20 minutes. I'm bumping out in that 20 minutes to do my other checks. So you can see how this is going. I'm almost talking fast, but it's very critical when I get my periods of time, especially when I have my pinch points. That comes across seamlessly. So I do this. So what happens is, and then I say, okay, that I'm actually walking through the entire treatment in my mind. Here's what I do. Everybody knows what they're going to do. I know the patient's in, the patient's on time, away we go, and I've worked my way through, and then I go through and I'm into my next period. And the nice thing is sometimes you say, oh, well, this is good. There's 2 doctors on. I'm only going to be checking 3 patients in this hour. Got a little bit of time in here. So I'm getting some breathing space, and the key is this. My patient in my theater, in my operatory, does not know what's going on here. They never know that I'm supposed to be getting up to do a hygiene check. If they do, I do it in terms of, it's time for us right now to wait for this to set. Marnie will stay with you. I always build it into their experience. So then when I walk in a very controlled fashion, and I give my time and attention, but it's got to be set up and coordinated by the team. Even though I'm sitting here doing this myself, my team knows what's required of them for the patient experience. So walking through in this day, And I know I'm getting a little detailed with this, but this is a very critical thing we're doing. As I walk through, I'm walking through every segment. So you can see how this works on the screen. And then what happens is, now let's summarize what I've done. My day is done. So what's happened during that day? Because I started out in a day where I know exactly what's happening on the screen, I also know it's going to change. And it's going to change on the fly. But knowing what I started with, I have to be adaptable. And here's an interesting component of this. There's some on my team that are so regimented in terms of being just great with the schedule, great when they're being prepared. They love their ducks in a row. But when it hits, you've got to have a team approach, so we pick it up with support. We know where we've got to put people in. We may have walk-ins. We take walk-ins. We may have a walk-in cleaning that comes in. A walk-in cleaning will go into this schedule, and it's not on this screen. So if I don't know where my pinch points are, I need to really be on stage when I sometimes have to go over and above and maybe be a little quicker in my check. You can't be perfect, but what happens in that, I also know when I start to get some flexibility in my schedule. So I've walked through my day, I look for my pinch points, I look for my openings where I need to maximize that schedule, where I need to possibly pull. Where can I pull from? Can I pull from hygiene schedule? So if I go and I look at Mary and Mary has a restoration done, and I don't tell Mary I've got a 45-minute opening in my schedule. I say, Mary, would you like to do this while you're here? You're pre-medic. Would you like to do this? We can do this for you right now. And the way that you say this in a trusting, caring way, you know what? They even think it's better. I had an opening, I went into Mary, but I have to know I have an opening. Another thing I'll do, I know maybe I've got 5 minutes. 10 minutes while I'm waiting for anesthetic to work. I don't have a pinch point. So I check and I look for some of these wonderful things that can upgrade where they are, some of the attrition, some of the abfractions, some of these things that really can be put in. And here's what it does. Not only does it maximize my schedule, my team is ready. The operatories are ready. I've got 3 assistants. One of them is with me as a treatment coordinator. So automatically when I go in, we know we've got 10 minutes. We've got 5 minutes. I don't need to go back and talk on the phone or check my email. I don't need to do that. The person who's with me already knows exactly what's happening. They will know exactly what the financial situation is, maximizing their insurance with that patient in the chair. Probably in a 12-hour shift for me, I will actually put into my schedule, even a busy schedule, I'm not talking about openings, a schedule which looks pretty maximized. I may put up to, what would I say? I would probably put at least $1,000 to $2,000 of dentistry in. In that period, it already looks like it's full. And the reason I do that, because it's better for the patient. The patient is there. The operatories are ready. The team is there. I can handle it. I can handle it in such a way that the patient just feels amazing that I did it that day. We're walking the talk. We talk about walk-ins. We talk about walk-in cleanings, walk-in and we also talk about same-day treatment. Not on everybody, but when we do that, can you see when somebody's home, when they've done this, they're talking, they looked and they saw, well, this just was something he was just doing extra to just, overutilize your insurance. He showed me the photographs. He showed me what was going on. He showed me the after. Not only did he do that, he did it quickly. And you know what he did? He didn't charge me for it. Why wouldn't you do that? Let's talk about that. You want to look after your patients. You don't want to just always look after their insurance. You want to know what it is, but I want to tell you, I want to look after our people. So if they're there and you're doing this, what better way than to maximize your time that's already there? Once that time's gone, it's done. So when you're doing this, don't always look to say, if this isn't covered, I'm not doing it. If you've got the time, why would you not do that? You should do that. And it's an important thing and a tenet of what you do in looking after your people. The rewards that follow are not just They're not just maximize their insurance. Let's maximize the patient experience. So at the end of the day, walk through my day. Look for the pinch points. Look for the openings. Look for the flexibility to add and accommodate. And another thing you want to do is, in my schedule, I want to kind of key in myself who's coming up. So when I walk through my day, I want to know. I want it to be personalized for me. Mary's coming in. Oh, Dawn's coming back in there. I wonder what's going on. I wonder what's happening with her. Even though we have some of this personal stuff done ahead of time by the team, so I know, but the fact that I know it helps me walk through my day. What is she like? I wonder what she's doing. She's a difficult patient. I may need a little bit more care with her. And then what I do, the last thing I do in my day, I scan to the next day. I'll actually go straight up and I'll say, okay, I'm pretty good with this day. and then when I'm going to go to the next day. Okay, here I am. What's going on? What do I need to look for the next day? So as I'm going through my day, I'm thinking, ooh, I've got some slots there tomorrow. I better look when I'm doing my hygiene checks. I better know what's coming up the next day. So I would say to Mary, Mary, you should get that done as fast as you can. You know, does she need to have it done as fast as you can? Why not if she needs it? Do you want to I'll get you in tomorrow. Oh, that'd be great. So see what I'm always doing. I'm not only maximizing my day and maximizing the experience, I'm looking for touch points. I'm walking through my day. So I guess to summarize here, you're looking for your day. This sounds like a long procedure. It's not. So where it comes down to, I will do this, I'll write it out in 2 Post-its, they go in my rooms, so when I'm in the middle of my day and somebody comes in and says, we've got so-and-so, we've got so-and-so, this has happened, that's happened, I pull my little sticky out and I'll go, great. I don't have to then go and do this same dance across the schedule. I'm busy. I'm busy doing exactly what I love to do. So maximizing your day, maximizing your insurance, it's not about the money. We're maximizing the patient experience. It's a wonderful dance. And when you talk about productivity as a reward, you can imagine what my day looks like at the end of the day as far as my production total and my metrics. So that's my huddle. Let me ask you a question. What are your patients saying after they just arrived there, sat in the chair, diagnosed with 2 loose fillings, and the patient maybe says, can you do anything for me now? Can you do anything now? And you say, no, I'll get you back. And then there's a conflict of schedules. They go out, they get an appointment booked, usually at a time that doesn't work for you. Can you get me a visit tomorrow at 7 o'clock at night because I work? Well, no, that doesn't. And you can see the scenario that happens. So here's what I would say. Don't we all want to have a growing practice? Don't we all want to have loyal patients? Don't we want to happily do everything we can to maximize the patient experience? So listen to that conversation around the table at night. My patient would say, you know, I would see Dr. Bob. I was in there the other day. He's busy. The practice is just, he's been there forever. And you know what? I had a couple fillings to do. You know what he did? Not only did he show me on the screen, he popped me in the room. He didn't hurt me. He did it. Look what I have. I have the photo to show this. Isn't that amazing? I didn't have to come back. So what are your patients saying about you at your table that night? And I guess the next way to look at it is, and doctor, and because you're busy like this, should it not relate to how much revenue either you're making, but are you making $800 to $1,000 an hour? Not because that's your focus, but your focus is on this very thing about walking through an ideal day for the patient first. And the ideal part of this is you're going to make lots of predictable, sustainable revenue.